Hi, my name is Danielle Cruzel, and I'm here to talk about ADHD as a global concern. According to the Center for Disease Control, 9.5% of American kids ages 7 to 17 have been diagnosed with ADHD, although the United States is not the only place to experience such elevated numbers. Our world as a whole has seen a surprisingly high increase in the diagnosis of ADHD, or attention deficit hyperactivity disorder, and everyone seems to have their own theory of why that is. I hope to better your understanding of what those theories are, what the disorder is, and why it's so controversial. I'll be doing this by explaining the disorder, explaining how it's diagnosed, and explaining how it's treated. A lot of you are probably thinking, isn't ADHD just when when kids misbehave? And that's true, that can happen, but that is because kids with ADHD are inattentive, hyperactive, and impulsive. And according to Catherine Brown in her 2003 article, Attention to New ADHD Genes, she writes that researchers know more about ADHD than any other behavioral disorder, yet there aren't any set causes of ADHD. Nobody knows why it happens. Research done on biological influences have shown that dopamine is a neurotransmitter that sends messages to the other part of the brain that deal with attention, and kids with ADHD have too much of it. And although that seems like, okay, there's the cause, there are other factors such as environmental factors, and even Tania Banjari in her 2007 article, Environmental Risk Factors of Attention Deficit Hyperactivity Disorder, that the heredity of ADHD is 77%. That seems like such a high rate, but that's without taking into consideration things like diet and exposure to toxins during pregnancy. And in Banjari's article, a researcher wrote that they claimed to have cured ADHD by eliminating additives in their diet during pregnancy. Another environmental factor is alcohol. Like fetal alcohol syndrome, ADHD kids have similar behavioral patterns which lead Banjari to believe that there is a connection between ADHD and alcohol. But the reason that it's so hard to determine if it's biological or environmentally the cause, there is no laboratory test for this. All of the tests are done clinically, and the conclusion to be drawn of which is the cause is impossible. And because of this, the diagnosis of ADHD is so complex. ADHD is the most common diagnosis for school-age children in the United States, and gender, race, and region affect the diagnosis as well. Boys are more likely than girls to be diagnosed with ADHD, although Caucasian boys are more likely than African American ones because it is believed that the parents are not aware of the signs or the symptoms of the disorder, which was written by Joanne Clark in her 2003 article, Magazine Portrayal of Attention Deficit Hyperactivity Disorder. Clark also writes that Colorado has a less amount of diagnosed kids than Alabama does. Why this is not really sure, because there is a mainly used source to confirm the diagnosis in ADHD, and that is the DSM. And Andrew Rowland of 2002 writes that in his article, The Epidemiology of ADHD, A Public Health View. And there are differences in diagnosing ADHD between countries, even though the DSM is the almost universal way to diagnose it. In the United States, there are many different medical providers who can diagnose ADHD, such as a general physician, a nurse, a psychiatrist, or even a neurologist. But in Europe, ADHD is generally diagnosed by a specialized child psychiatrist. And although the diagnosis is different among countries, stimulants are the most popular treatment of ADHD. The most common types of stimulants to treat ADHD are Adderall and Ritalin. Many of you may have heard of this because it's very common, and stimulants are used to indirectly regulate dopamine, which we discovered sends signals to other parts of the brain that have to do with attention. So it regulates the kids that have too much. And although stimulants have proven to be helpful in regulating the dopamine, there are public health concerns with the use of them. Kids are being diagnosed and treated that are being diagnosed and treated have a higher risk at more serious behavioral problems. For example, they are more likely to smoke, drink, do drugs, or participate in risky sexual stunts. They are also more likely to self-harm than any other kids that aren't on medication for ADHD. And along with those health concerns, there are controversial ethical issues in using the psychotic drugs. Ethical reasons like children are taking stimulant drugs that have been tested on adults. They have no idea what the effects do to these children. And another thing is oftentimes when one drug doesn't do enough, they try another one. And there is no research done on psychotic drugs. More than one psychotic drug taken by these kids. It's just there's so much that they don't know. And if you take a look at what ADHD is and how the differences in the diagnosis is and the controversies over the treatment, you can see how ADHD is such a global issue. The lack of research done in some areas make it impossible to determine the cause of the disorder, and then they don't know how to go on and treat it properly, which causes more controversy. Understanding the symptoms and theories of all these causes will help you have an educated idea of what ADHD is and how it is really affecting our world. Thank you.